This lesson is about the distinction between telling versus asking. Following examinations, most dentists tell patients about conditions they may be unaware of. Instead of telling them, I suggest asking them if they are aware of their conditions. Here's why. When telling patients about their conditions, it's usually followed with treatment recommendations. It sounds like this. Mrs. Chambers, you have periodontal disease and you need scaling and root planing. You also have broken silver fillings in your molars and you need 3 crowns. I noticed in your x-rays your first and second bicuspids have abscesses and you need 2 root canals. Now, to patients, this approach of discussing conditions sounds like you need. Patients are not part of this discussion. They're just being told what they need. Not only does this approach lack appeal, but it doesn't at all discover anything about the history of the conditions or treatment recommendations from previous dentists or whether or not patients are concerned about conditions nor their readiness to treat them. Now, a much better approach to discussing conditions patients may be unaware of is asking them if they knew they had the conditions. This question can be followed by discussing the history of the conditions, treatment recommendations from previous dentists, or whether or not patients are concerned about the conditions and their readiness to treat them. It sounds like this. Mrs. Chambers, did you know you have some gum infection around your lower molars? Now, if she wasn't aware, she may say so and probably be curious about it. This creates the opportunity to talk about patients similar to her who have gum infections and the consequences of not treating them and whether she's concerned about those consequences. Now, if Mrs. Chambers is aware of her gum infection, you can discover the history of her condition and the decisions she's made about them in the past. This information gives dentists greater context for treatment recommendations, and it feels more collaborative to patients. Patients want to feel part of the decisions for treatment recommendations and not just being told what they need. When it becomes critical that your practice better fulfills its vision of providing excellent new patient experiences and improved treatment acceptance, my work becomes the perfect companion to fulfill that vision. When you're ready to discover more, consider visiting Treatment Acceptance Mastery. Thanks for listening.